So today we're going to do a figure of 8 wrapping. So this is 3 ace bandages kind of sewn together with an elastic loop. The elastic loop is meant for to help with like one person doing it. But when you first put it on, you're going to wrap it around the waist, just like this. Then you'll take the ace bandage wrap, thread it through the elastic, like that, and then you'll spin. So this elastic part is going down the back side of the patient. And you do want to kind of cinch it so it's snug. Make sure that it's not cutting off circulation or anything like that. If you'd like to go down to the side for me. Yep. So then you'll take the ace bandage wrap lengthwise and have it go down the back side of the patient to cover up the bottom part of their limb. So he still has some seepage coming from his wound, so I'm going to cover it up with this bandage, and then just move his shorts out of the way, and then yep, perfect. And so when you make this first part, you're going to put your hand down, and then you'll come across. Then come down at an angle, and you're going to overlap the ace bandage wrap. Continue around. Then hit the overlap on this part, and then you'll just repeat that process of doing the figure 8 going across. And so you want to make sure you're pulling it tighter on this bottom part, bottom few sections. Across, and then just slowly increasing the height at which you scoot it up after every roll. As you get higher up, you can let less off on the tension that you're pulling on the ace wrap. And then as you see, every time I'm going in through here, I'm kind of just sliding it up just a little bit higher to make sure that it's not all being bunched up just right here. And so we are increasing that kind of proximal pull. And then keep moving those shorts up. So for him, because his leg's pretty short, I like to end where the wrap is going towards the outside, because then I can start doing another wrap for the waist cinch again. If you kind of have it go across, then it tends to get in the way if he has to go to the bathroom or anything like that. So what I'll do, especially if I'm by myself, I'm going to tuck it into right there. And then if you want to, I'm going to have you transition back onto sitting. So you can support the patient, make sure he's getting up safely. And then you will take your waist belt and then go back across and just kind of wrap it until you run out of room. So